flu, H1N1, Africanized killer bees.
that was your beat, huh?
Been there for all the health scares.
SARS.
SARS. Oh,
Do you know, I think it was SARS.
Get
Or
those
H1N1,
masks.
and they
Get
sent
those
us to
masks.
some clinic. It was back on CBS. They sent us, and the desk or who they gave us respirators or whatever, and we go into this clinic, and all the doctors started laughing at us. They're like, "That's not going to help you."
Show up in hazmat suits.
Yeah, maybe that would be it. But they just, like here we are, like, thinking, well, we're doing what we can.
Probably like painters now.
Yeah.
When we were doing live shots outside the bowling alley and the meatball shop,
Oh,
we got
right.
that when we
Yes.
came back from the thing.
I did the meatball shop. I didn't do the bowling.
We did the bowling alley, and we were at the wrong bowling alley. And then
How many bowling alleys are there?
Because it was like, it's a Brooklyn bowling alley. It's like, great, Brooklyn Bowl. That's got to be it. And we're there. And so the trucks are there.
Oh, it wasn't Brooklyn Bowl?
It was like
Some
some
little tiny weird bowling alley.
near Brooklyn Bowl.
I know that bowling alley. I've been to the bowling alley.
Yes.
They had meatballs.
Yes, they had to go to the meatball shop to prove that it was okay.
There were like 20 carrots.
Yes.
And acid, carrot, acid.
Yep.
I'm gonna look for one on that part.
It's okay to eat meatballs. And it was funny because the doctor was like kind of a hipster, so it was like the retracing. You went on the high line. You played banjo for a while. We're tracing his whole steps, and that's not how you can't get it from.
Did you ride a fixed gear bike?
He was a total
Okay.
Yes, thanks. I'll be calling.
Yes. Big news conference.
Oh yeah, inside the lobby.
Right. Yes, I do remember that. Wow.
Yeah, you were there.
And I feel
Miles
that-
was very new there.
I seem to remember the doctor wrote like an op-ed later taking the task with the whole thing.
Oh, really?
Was it just right? It wasn't just us. Like, there's some, like, you can't get it from sharing the bowling ball detections, but they still show you the bowling alley have hats.
Yeah,
I mean, bowling shoes are kind of nasty enough. They just spray them. Does that kill a bee?
You know, I think it's like health department guest or DOHMH guest. Yeah, I think it's not like a different. Sounds silly, but we don't have to use our own free access Wi-Fi. Have you guys done a mic check?
Yes.
Our cameras all are done.
You can hear from the spine, right?
Oh, that one? Yeah, okay.
I just plugged it through back.
Yeah, everything's
Thank you.
Wait, can you give us a mic check first?
Oh, of course.
1 minute? Yeah. All right.
Hello? Yes. 1, 2, 3. Yes. Okay. Everyone's good? I know, you just got here. I'll wait for you. Yeah.
You keep talking for a second?
Of course. 1, 2, 3, 4, 5, 6, 7, 8. And I know Fox still needs to.
How high can you count?
Chris. And also, Fox is still sitting in their camera, so they just need that.
Holy shit. Yeah, it's a good friend of mine's dad died. Right here.
Like suddenly.
What? He was in an accident, but he was doing better. Yeah.
One more mic check there.
Of course, yes. 1, 2, 3. Good. Okay.
Oh, really? Who's up on the stairs there? I guess the microphone is taking this. I was wondering what they're going to go with. And also I'm wondering the intent of the web writer in if have this bacterial resistance flag in public to reassure the public or basically exposing us bacteria. Hey, it's Mike George and Joe. Hey, whose conference is going to start in the next minute? I have bad service, I can't send an email. Just want to get the next minute or two, yeah. No, I'm not. Okay, fine.
No. It's not. No. I know that being six.
Good afternoon. I'm Dr. Oksidi Sparbo. I'm the acting health commissioner. I am joined today by Dr. Dimitri Daskalakis. He is our deputy commissioner for the Division of Disease Control. Today we were notified that a flight, Emirates flight arriving at JFK, had a large number of passengers that were ill. This was a flight that had 521 passengers. 106 of them presented with symptoms ranging from cough, fever, vomiting. I am pleased to say that in collaboration with the CDC and the State Health Department, all the passengers were assessed and that the vast majority were cleared of any illness and were allowed to continue on the remaining legs of their trips. Additionally, there were 10 people in total that were determined to be ill. 7 of them were crew members, 3 of them were passengers. They were transported to Jamaica Hospital, where they are currently being kept, and they are all stable. I am really pleased to say that this response was a tight collaboration, not only between state and federal partners, but city partners as well. In addition to ourselves, we had assistance from FDNY, NYPD, Office of Emergency Management was also present, Port Authority aided in this response, and currently, as I say, we have these 10 patients. All of these patients, we obtained respiratory samples that are being tested at our public health lab. We anticipate that late tonight we will get final results. But I want to just say that given the symptoms that we are seeing in the patients and given the histories that they present, it looks like this is probably influenza. But again, until we have our final results late tonight, we won't be able to give a final determination of what the underlying cause is of this illness. So I'll open for questions. Yes. Sorry, Chris.
I have 2 questions. The first is, there was reporting earlier, I think it came from the city, that a sizable number of these people had come from Mecca, and I guess I'm wondering, can you confirm that and talk about the significance of that as a disease kind of incubator, if you will? And I guess the second question is, if it is influenza, is it common for some number of people to get onto an airplane and 12 hours later for 106 people to be sick? Sorry.
That's okay. So I'll take the first part of your question first. I think anytime you have large numbers of people attending an event, whether it be religiously based or a sports event or anything like that, where they spend a significant amount of time together for prolonged periods of time, it can be a situation where transmission, respiratory transmission of viruses can occur. The second thing that I would add is, the flight from Dubai to New York City is a very long one, and so you can have ongoing transmission in this type of an environment. Typically, the incubation period for, let's say, influenza can be anywhere from 1 to 3 days up to about 7 days. So it's not out of the question that individuals attending a large event could have contracted influenza. There is influenza in the Arabian Peninsula and then transmitted it on this flight.
Is there any idea that maybe only the 10 people that were treated had a stronger case of the flu, and maybe other people, those other 106 that were seen by folks or that were seen by responders, that they also have maybe just milder cases, or is anything known yet?
So all patients were screened by the CDC, and they were given information about contacting their providers if they happened to develop symptoms afterwards. But the screening was very thorough, and the likelihood of illness is low. The individuals that were transported to the hospital were actively sick.
What goes into the screening process for the flu?
So there were a series of questions asking them about their symptoms. I'm going to transition to Dr. Daskalakis if he has specifics on the particular questionnaire that was used.
So the CDC did the screening, and it involved both historical questions about symptom complexes, so typical symptoms of respiratory infections, coughs, fevers, shortness of breath, muscle aches, GI symptoms, so gastrointestinal symptoms, but they also included screening with temperature. So in terms of what you can do on a tarmac and on a plane, we're the ones who are going to be doing the complex laboratory diagnostics, but their quick evaluation really is pretty sensitive for identifying people who are sick with respiratory viruses. So simple tools like history and a temperature are what the CDC starts with.
When you're so ill that you end up in the hospital just a few hours later, should you even be getting on that flight? And my second part of that question is, for those who left the flight seemingly healthy, how long until they know they're in the clear and they haven't picked up this illness?
So the incubation period for influenza ranges anywhere from 1 to 3 days, 7 days at the outermost edge. So depending on when they traveled, but generally that seven-day window. In this situation, as in situations when people are sick and they come to work, the rational advice is, if you're sick and you could potentially infect others, don't come to work, don't get on a plane, and take care of yourself.
Can you talk a little bit about the 106 number? Is that people that reported feeling sick? How did that kind of number get?
Yeah, that was the preliminary number that we got, and then from there, through the questionnaire, we were able to whittle that down. Sometimes what happens is, folks will be what we call the worried well, and so when you do a comprehensive questionnaire, you can sort of weed out what are symptoms compatible with a likely illness versus something else.
So those were people who reported themselves. They said they were sick.
That's my understanding.
So that's what we heard when the flight first landed, and then when actually going deeper with the questionnaire and other assessments, it went down to a very small number.
How often do cases like this happen, where a bunch of people on a plane suddenly get sick while they're in the air, and then have to go through this whole quarantine screening issue?
The frequency question I'll leave to Dr. Daskalakis, but there have been other situations where, for example, we've had to do measles investigations because someone ends up with measles. They may not be necessarily symptomatic, but then it turns out that they end up with that. So I would say probably less than 6 times a year.
Yeah. I think this one is particularly dramatic seeming because we have a number of people who are on the plane who are reporting illness. So this specific scenario happens rarely. About, let's say, 6 times, 5 times a year, we'll have reports of someone who traveled ill. We find out what that illness is, and then we collaborate with CDC and others to identify sort of who we have to talk to on the plane, who else needs to be tested or notified, et cetera. So it's not very common. This one specifically is not very common, but following up folks who are ill on a plane, it does happen, but not at a high frequency. I think an estimate of 5 or 6 times a year is probably fairly accurate.
Are you concerned about any other flights coming out of Dubai?
You know, at this point, there isn't anything that leads us to believe that we will see the same thing in other flights, but I think that we've proven that if and when it does occur, that the city is ready in collaboration with our federal and state partners.
Where did you treat folks on the plane? Did you have them go to some part of the plane or just on the
So the questionnaires were conducted on the plane, and individuals that were found to be sick were transported to Jamaica.
Can you tell us a little bit more about the condition of the 10 who are still being treated?
So they're all stable. They're being, I don't know if I should say that, but they're all being fed pizza. So, you know, I think that the important thing to note is that they're all stable. No one is, you know, needing any extreme measures. Yeah.
Were the, all of these people, the 106 number, were they all kind of in close proximity to one another? Or is this the kind of thing that is, and I guess there are questions people have when they get on a plane. I mean, is this, you know, you're in a tube, is it all recirculated air, and is everyone at risk? If somebody in row 42 is sick, can you get sick in row 10? And then I guess, bigger picture, I wonder if you could talk about preparation in a kind of Ebola age. You know, New York City had Ebola. The plane comes in sick. What's the training and the preparation and the drilling that you do, and were there lessons learned from this?
So in terms of the communicability of influenza on a plane, you know, there's a lot of factors that go into that. Someone in row 10 may have gotten up and gone to the bathroom and not washed their hands and touched the, you know, the next person who touches the knob. And so it's difficult to really sort of pinpoint that. Would you agree, Dr.? Yeah. And so that then is a reminder of how it is that we avoid the flu, which really the best way is that if you're sick, stay home. And then if you are on the sort of recovery stage or season is upon us, hand washing is really critical. In terms of the preparation, I think that the fact that federal, state, and city agencies were able to mobilize in such a quick manner, and we have a good sense of what's going on, I think it's indicative of the training that we do collaboratively, and really to highlight the importance of federal grant dollars that we get that support emergency preparedness for our hospitals. And, you know, the truth of the matter is that those funds under this administration had been earmarked to be cut. And so this is a prime example of the importance of all of the drilling that we do so that in these situations, be it influenza or be it something else, the city is ready.
Are we in an age right now that when we do fly, especially with it soon being flu season, that we should be carrying our own wipes and wiping down the surfaces, bringing masks, and do those masks even work?
You know, I think that I would say, and I'll let Dr. Daskalakis sort of weigh in, the issue of wipes, I've seen folks do that on planes. You know, it's sort of analogous to the hand washing recommendation that I did. So I think that's always a good idea. On the mask question, because this can be transmitted, as I said, in terms of like respiratory and secretions, I'm not sure how effective a mask would be.
I wouldn't recommend starting to use masks for routine travel, but what I would recommend, especially in the season, is to get vaccinated for influenza. The season is upon us and the flu vaccine is available, not only at your physician's offices, but also at pharmacies. So this is a great time to get vaccinated because it will prevent complications of the flu, prevent the flu, and also it gives you enough time before the season really kicks in.
Did you guys have any involvement in making sure the aircraft was clean before it went
So I can answer that. So we don't think it's going to need any specific clean, but that actually is something that the CDC works on with the airline.
Would you get on that plane back to Dubai? No, I mean, like, do you think that it's been cleaned, and if it isn't cleaned, would you get on that plane back to Dubai?
I think the important thing here to note is the precautions of hand washing, and so that would be, I think, the important message to convey.
Yeah, what's the, I guess, like, what's the degree of illness that someone has to, you know, obviously be displaying for them to not be let on a plane? Like, what's the procedure there? And I guess if some of these people were, like, obviously sick before getting on, like, how, you know, what bar did they have to meet to be like, you cannot get on this airplane?
So I don't know that we're in a position to comment on what happened in Dubai with this airline, but again, the recommendation would be that if someone is actively sick, and especially in the early part of their illness, the best thing to do is to stay home.
What was the degree of fever that you found in the passengers as they were screened getting off the plane?
You know, I think the range of temperatures varied, but the important thing to note here is that with influenza, you can have cough, you can have GI symptoms, and you can have fever, and the level of temperature doesn't necessarily kind of throw you in one way or the other.
What was the highest number?
I don't know that we have that, and again, the important thing to note are the symptoms, and the level of the temperature doesn't really make a difference in terms of moving forward.
Great. Thank you.
All right, thank you.